In tonight's Health Edge, should dentists be able to drill patients about their drug use?
A new survey finds more than 75% of all dentists are now asking more questions about illegal drug use. Well, Chief Health Editor Dr. Nandi is here now with more on this controversial idea.
I love it. I love it because, you know, a lot of dentists are prescribing medication. And so what happens is that dentists are the #2 prescriber of pain medication. So I think it's great that these dentists have the, courage and also all the training they require to be able to ask these people for drug use. So remember, also when you have drug use, what happens is you have more tooth decay, gum disease. So they can see that, and if they see that, they say, listen, are you using X, Y, and Z drugs? So I think that's really important for them. Secondly, they treat emergencies and a lot of tooth pain, so they are prescribing pain medication. So I think it's really important, and it's a great way for us to try to get these people treated early.
I have my blood pressure taken at the dentist. You go in, it's a real doctor visit, and I think that's important for people to know. What's the need for this? I think
it's huge need, because in some places they're the only healthcare provider you have, and so you miss an opportunity if you don't ask for screening for drug use. So it seems like younger dentists that are female are more prone to it. But we can have all the dentists on board to fight this problem because it's an epidemic. A lot of my patients come in and they're supposed to get the pain medications for, let's say, a few days, but they're on it for a month. And then that starts the whole cycle. So if dentists are not asking about it, you'll never know.
Especially for young people. So we've got to move on, but let's talk about a new study, because you said something about our waistline can actually bring on Alzheimer's early?
Yeah, it's very, very important. So my goal is that, Alzheimer's is such a disabling disease. If we can prevent it early, it'd be phenomenal. So what they're finding now is that at midlife, at age 50, if your BMI is over 25, then your risk of early onset of Alzheimer's is up to 7 months. And doesn't stop right there. So as you get more and more obese, the risk increases. So to me, it's great because guess what? Another reason for you to eat in moderation, exercise, not only for your heart disease and diabetes, but also for Alzheimer's. So I think they're finding that there's some abnormal protein that you find in Alzheimer's increased in patients who have increased BMI. Also, they're finding accumulation of fat in the brain. So all those factors together. Here's the thing, though. There's so many things we can't do something about. But if you're watching and you're obese and you're close to 50 or midlife, do something about it. Get rid of that fat so you can help to decrease the onset of Alzheimer's.
So true. All right.
Absolutely.
Thank you so much, Dr. Nandi.
It's my pleasure.
All right, Doc. And if you have a question or health concern you would like to ask the good doctor, you can email him at drnandi@wxyz.com or send it to us on Facebook and Twitter, and we'll get it to him.